got is the patient is traveling and requesting for antibiotics. Okay, so you are FY2 in GP surgery, and the patient is 48, and he has made an appointment to see you. The task is to talk to him, assess him, and address his concern. So you will see nowadays most of the tasks are like this only. They won't be giving you, I would say, enough information in the question. What will be given to you in the question? That patient has got some concerns. That is it. Okay. So the task is patient has made an appointment. So how can I help you? The patient is like, I'm going on holidays to Thailand, and I want to get some antibiotics to take with me just in case I develop any infection while I'm there in Thailand. Now, see, in the UK, giving antibiotics is a big thing. They don't give it to they don't give it to us just like that. There has to be a reason behind it. That's why, like a lot of us, whenever we come to the UK, what we do, we get a lot of antibiotics with us because we know here, if you're going to go to the GP, you're not going to get antibiotics that easily, right? So usually in this station, as patient is requesting for antibiotics, so usually we don't have to give. However, in most of the scenario, even if it is a reassurance scenario, even if you have to say no, you have to rule out some of the criterias, because there are some criterias where you might be giving antibiotics to these patients as well. So what I mean to say is, whenever patient is requesting for something, do not deny straight away. Acknowledge, I can see you are going to Thailand and you want some antibiotics. Let me ask you some questions to see if you really needs it or not. So that is something that you need to do. Acknowledgement, and more of acknowledgement. Do not come to the conclusion of any station in the beginning. Just take a bit of time building that rapport, right? Now, what you do, take a bit of history. So patient is planning to travel. The person is planning to travel. So when are they planning to travel? That's one thing. And we have got some vaccination as well, travel vaccination as well. So you can ask if they have taken those traveling vaccination or not. One thing for travel vaccination, I would say, travel vaccination is not like you can just take it now. So usually travel vaccination is usually given 6 to 8 weeks prior to travel. Right. So that's why it makes sense to ask, when are you planning to travel? Because if the patient is saying, I'm traveling in 1-2 weeks, will you be able to give any vaccination thing? Not really. But yes, in the future, if patient is planning to travel, so at least you can say before traveling 6 to 8 weeks, you come to us so we can give you some vaccination that might be quite helpful, right? So who are you traveling with? That is really important. And if your wife has taken the vaccination or not, and if you are up to date with your regular vaccination or not. So these are the main things. These are the main questions that you can ask. So patient is saying, I want some antibiotics. And so you are asking, patient is saying, I want antibiotic because I'm traveling to Thailand, just to make sure I don't get an infection. So when are you planning to travel? Have you taken any vaccination or not? Whom you are traveling with? If your wife has taken a vaccination or not? Are you both up to date with the vaccination or not? Right. Now, patient is worried about infections. Which infection? That is really important for us to know, right? So which infection? So patient is saying, I'm worried about stomach and the chest infections. All right, that's okay. Now we need to know, do we have any criteria where we may be able to give antibiotics to these patients prophylactically? That is what we have to find, all right? So what happens is, usually we don't, but prophylactic antibiotics is given to whom? The person who is immunocompromised. If the patient is immunocompromised, you may be able to give prophylactic antibiotics. So if the patient has got some GI issues like Crohn's disease, or ulcerative colitis, if patient has got ileostomy, colostomy, obviously their chances of having infection is going to be high. So in these cases, we might be able to give it, right? And then diabetes, or if the patient is having any cancer, obviously diabetes and cancer is going to make the patient immunocompromised, and sickle cell disease, right? So if any of these things, any blood disorders, right? So if any of these things exist, you will be able to give prophylactic antibiotics as well. So that's why, whenever you get these kind of station, do not deny it in the beginning straight away. I've seen, like, whenever I practice with some candidates and we get these kind of station, I want antibiotics because I'm traveling. No, we can't give antibiotics. Come on, you can't come to the conclusion straight away. First couple of minutes, build the rapport and try finding if there are any risk factors or not, right? So this is what you have to do. If the patient has been diagnosed with any medical condition like any diabetes, any cancer, any sickle cell disease, any blood disorders, right, any GI GI issues, ulcerative colitis, Crohn's, you need to ask those questions, right? If patient is taking any long-term medication like say steroid, if patient is on steroid, what's going to happen? Their immunity is going to be low again, isn't it? So that is why these questions are really, really important. So if you get any of these things, answer is yes, I can give it to you. But if the patient is not having any of these things, then what I'll say, unfortunately, we won't be able to prescribe. It is against the national guidelines, and it's not a good idea to get it. Right. But sometimes patient says, I went to Brazil last time and was given antibiotics. Why was that? So the thing is, you can ask the patient again the question, say, I'm not sure why you were given. So which antibiotics were given last time? May I know what was the exact reason why the doctor has given you antibiotics that time? So you can ask all those questions, but obviously you're not going to give antibiotics if it is not fitting into the criteria. Okay. Right, so it could have been for a specific prophylaxis or due to the particular indication at that time. Without knowing the exact details, it's hard to say, right? So we don't generally give antibiotics in terms of diarrhea and all. And you can also ask if the patient has got any medical insurance and all. That would be very, very important. And for example, patient is traveling to Thailand, so we can talk about the mosquitoes as well. So they can use like insect repellent and wear long sleeves to avoid bites. So if you have time, maybe you can talk about these general things as well, right? Now, this patient has got some concern. This patient has got some concern. This patient is asking, can I take loperamide? He's using the word Imodium sometime. Can I use loperamide as a prophylaxis? That is the question that patient is asking. So if you get diarrhea, then maybe you can take loperamide. Usually it's not recommended. What they say, if a person has got diarrhea, the thing is, we have got the infection in the stomach and it's coming out. So they say, let it come out. We try not to give any medication to stop diarrhea. All right. However, if it is kind of urgent, you are going for an important meeting, you have got a concert to do, right? So in those cases, maybe yes, but can I use loperamide or Imodium as a prophylaxis? The answer is no, it cannot be, right? And tell the patient, consider buying some ORS in case if you get some problem, right? But vaccination, as we know, it is given 6 to 8 weeks prior to the travel. So that is something that you can ask in the history as well. Another thing is if the patient is on any chronic medication, right? For example, patient is taking the medication for anything, for high blood pressure, for anything, is he gonna get the full supply from the NHS? So NHS accepts responsibility for supplying the ongoing medication for the existing medical needs for temporary needs for around 3 months. So the patient is taking any medication for any chronic illness, they can get the supply for 3 months, not more than that. The patient is saying, I'm traveling for 6 months, they will be getting it for 3 months only, right? So that is it. So vaccination, as I said, you have to get it 6 to 8 weeks prior, but where you can get the vaccination, you can contact your GP, you can get it there. Vaccinations are available free on the NHS, including these polio vaccination, diphtheria, tetanus, typhoid, hepatitis A, cholera. But for some of the vaccination, you may have to pay as well. So for hepatitis B, Japanese encephalitis, meningitis, rabies, tick-borne encephalitis, you may have to pay as well. It's not like everybody has to pay. Some of the patient might have to pay as well, right? Now, there is something called standby antibiotics, right? So where access to the standby antibiotics usually given when access to the medical assistance is poor or not available, right? So for example, you're going in an area like you're from the media, you're a journalist, and you're going to a place where you know the medical assistance is not available properly, not proper things are available. In those cases, you might be given standby antibiotics. Okay, so now what we need to know, I know we have learned a bit more in this. So what we need to know, patient is requesting antibiotics because of the travel. So you have to ask, where are you traveling? When are you traveling? Are you up to date with your vaccination? Do you have your medical insurance? Whom you are traveling with? If they are up to date with the vaccination or not? So here are the questions that you can ask, right? Then you ask if the patient is immunocompromised or not to see if you have to give antibiotics prophylactically or not, right? So check if the patient is immunocompromised or not. Then what you do, you take quick past personal history as well, right? And then we tell the patient it's advisable not to have the antibiotics because we don't usually give it. It's against our national guidelines and it can make you resistant as well, right? But there are a few things that you can do from your side is take these things with you, like ORS maybe, right? So that might be quite helpful. And in future, if you're planning to travel, let us know in advance so we will be able to give you some extra vaccination as well, right? That's the thing that you can mention. Doctor, can I take Imodium loperamide as prophylaxis? The answer is not really. Right. And that is it. So that's what you do in this particular scenario. Traveling patient requesting antibiotics. All right.